Well, hi everyone, I'm Judy Elliott and welcome again to Southern Surgical Art, and I am delighted to be here today with the new business partner here with Dr. Carrie Neese, and that is Dr. Chad Dill. And thank you, Dr. Dill, for sharing some time with us.
Thank you. I'm excited to be here. This is a really exciting time in my life, so
yes,
I'm very happy to be here.
Yes, and I know we talked a little bit before we actually started taping this, and it's exciting to learn about you and your background, your experience, and to introduce you now to our community here, and have to say welcome to our community. And I know you're going to be doing a lot of work throughout North Georgia area and surrounding areas.
Oh, absolutely. No, this is not too different from home. I consider myself a Southern boy. So Southern this is, and I'm right at home.
Well, let's talk a little bit about your background and your training, and kind of how you got involved with working with Dr. Neese, and just a little bit about your background first.
Well, I kind of grew up all over the country. I'm a military brat, both my mother and my father, but about the time that I ended up in Alabama is about the time I was in college, and so for me, Birmingham became home. For college, medical school, for general surgery residency. So I am a board-certified general surgeon, and that's where I completed my residency in Birmingham. And then I went to Las Vegas, Nevada, which let me tell you was interesting, but it was outstanding training, and that's where I did my cosmetic surgery training. And it was wonderful. Had a great time doing it. Learned an incredible amount of techniques and cutting-edge techniques for cosmetic enhancement. And it was a great year. But I'm happy to be back in the South.
Right, right. Now I know you trained with one of the cutting-edge surgeons in the past, and tell me a little bit about that, how that experience was.
Well, the gentleman I trained with is actually, he currently holds 4 board certifications. He's quite the trained gentleman. He's very brilliant, and I was very lucky to train with him for a full year, and I was his only fellow that year. But you know, besides the traditional things that you can do, cosmetic surgery is a very rapidly evolving field. I mean, medicine in general, as we all know, is very rapidly evolving. But every day there is a new tool, there's a new technique. There's always just a better way to do things, and the minute you think you know it all is the minute that you're going to fall behind. And so being with him, we really pushed the edge safely, you know, with patient safety being #1 about giving the best result that we can, you know, in 2010 and now 2011. So, and I'm happy to bring those skills back here, back to the South, and be back in the community that I love.
Right. Now I know that you and Dr. Neese have a strong partnership here, and how do you strengthen each other in the practice?
Well, before we were both cosmetic surgeons, you know, of course we both did our primary training, and he was originally a boarded ENT physician, so kind of a master of all things head and neck, and initially, and I was a general surgeon, so which is, you would think of more of a body type surgeon, and he went on to do his cosmetic fellowship, and of course is board certified in all things, you know, cosmetic enhancement from head to toe, and you know, likewise myself, I'm actually eligible for the boards because I just, you know, recently finished my cosmetic fellowship, and I'll take them in just a few months. But from a standpoint of our primary training, it's good to have those things, particularly for patient safety, because before we even talk about cosmetic enhancement, the #1 thing that we care about, patient safety. And so having a board-certified general surgeon and a board-certified ENT means that patients know they're going to a place where they can handle not only their cosmetic enhancement, but they can handle any potential problems that come up. So.
That's great.
Yeah.
Well, I know there are certain areas that you really enjoy about your part. Tell me a little bit about those. And we talked a little bit about that earlier, because we really haven't ever talked about this on this particular interview.
Well, there's a couple things that I wanted to talk about, because I know it's, you know, a lot of things that people are very educated these days, because there's been so many shows, and some things are glorified, and it's fun to talk about, but you need to realize that this is still surgery, and so, you know, you need to realize that that still, like I said, safety is #1. But outside of that, the things I am excited to talk about today are, #1, the Brazilian butt lift, and of course that is a coined term. There is no real procedure called the Brazilian butt lift. It's similar to what we call a tummy tuck. Well, it's really called an abdominoplasty. But the Brazilian butt lift is essentially a fat transfer to the buttocks for buttock augmentation. It was very popular out on the West Coast, particularly in Las Vegas, but it's just now kind of gaining popularity. And when I brought that procedure down to the South, somehow I started becoming, the butt doctor of the South. And I, initially finishing my fellowship, people knocking down my door to do it. But I'm very pleased with the results I'm getting with it. It's your own fat. In essence, as far as it being natural, there's no chance for rejection in the sense that there's no implant being placed. And patients are generally very pleased with the results they're getting with this procedure. So I love doing it. Post-operatively, seeing my patients and their excitement it's fun for me. That's one of the procedures that really just makes me love doing what I do.
Right.
So
who would be the candidates for something like that? How do you determine? I guess most women would know, like, okay, I really need something done here.
Well, yeah, I would say it's similar to breast augmentation.
Right.
If it's something that you're interested in or not. It's one of these things where
Clothes don't fit right, probably.
potentially, particularly, when you have a night on the town kind of planned out and you have a nice, evening gown on, and it just doesn't quite fit right. It does the same dress. We've all seen shows where they say, who wore it better? The same dress on one person versus another, and a lot of it has to do with the curviness. It has to do with looking feminine. A feminine body versus what we call the gynoid versus the android body. A feminine body has curves, and we've been focusing for decades now on the curves of the breast and kind of ignoring, the curves of the bottom. We can help a little bit by doing liposuction of the flanks and the abdomen. That brings in a little bit with hourglass shape, but if the buttocks is fairly flat, we've just been ignoring that. And now there are procedures that can address that. And I'm really excited about them. I mean, let's just say I've had very happy patients come into the office afterwards.
Right, right. And I would imagine quite a difference, particularly in their clothes. And I would imagine a lot of people come to you to talk about, hey, I'm just not really happy with the way I look. And then what can we do and how that is addressed?
Absolutely. And everybody is different. The same just size, if you just looked at a number, the same, width on someone that weighs 100 pounds or 150 pounds.
Right.
It's different. It has to do with proportions. Everything is about proportions. It's about the silhouette that you see. And, the patients know. I mean, this is not something where I have to look at somebody and say, hey, are you interested in this? I don't even bother. It's about them coming in and saying, I have a concern. I want to know if this is something that you can address. And we examine them and we give them, our best opinion of what we can do. But no, this is definitely something that women come in asking for in particular, and definitely something that I'm happy to offer because the results, as I said, are I haven't had too many unhappy patients. You never want to, in the world of aesthetic surgery, you never want to promise, perfect results. The goal is always improvement, not perfection. But this is one of those procedures where the vast majority of patients are very pleased with the results.
Good.